This hour, Dr. Peter Bray is here. He's a cosmetic plastic surgeon. We're going to talk about the most popular procedures in surgery for men and women. We will take your questions. Any questions, am I right to say that? Any questions they have?
We'll take it.
All right. 416-872-1010, Star Talk, star 8255. You can text us at 71010. Can people call and ask the approximate price of something? Are you good with that?
Yes, they can, and I'll do my best to give approximate details and take it from there.
All right. And you can be more specific, obviously, about the procedures and things like that. What I was going to ask you, what is the difference between cosmetic and plastic surgery? Is there a difference?
There is a difference. That said, all plastic surgeons would be trained in cosmetic surgery.
So what is plastic surgery?
That's the broad specialty that includes cancer reconstruction, burn reconstruction, and all forms of repair after cancer injuries. And cosmetic surgery would be a subset of that. And plastic surgeons are trained in all of those things.
Okay, so plastic surgery is if you need to fix something you after an illness or after something like that. Where there so is that kind of reconstructive?
Reconstructive surgery, yeah, you could think of that as building or repairing something that's been damaged. And we spend a lot of our time learning that type of surgery, as well as all sorts of other components. So it's quite a broad specialty, even though the public would often consider plastic surgery and cosmetic surgery to be one and the same
I
thing.
think people don't usually understand the difference, and I'm just kind of understanding it now for the first time. So, do cosmetic surgeons have to be plastic surgeons, or can there just be cosmetic surgeons?
They do not have to be plastic surgeons. So there's several different specialties that will perform cosmetic treatments or cosmetic surgery. So ENT or otolaryngologists will perform cosmetic procedures of one form. And there's really nothing that would stop another doctor or MD from performing cosmetic treatments. That said, our governing bodies are really starting to clamp down that these procedures should really be performed by people who have the specific training and expertise to do them properly.
So that seems to be a bit of a growing concern because I'm hearing news stories about these sort of pop-up clinics who are doing, and I don't know, is it a concern for people to be doing things like Botox and fillers, or is it more intrusive stuff like, you know, I'm sorry, but like putting cement into somebody's butt when they want a butt lift or something like that?
It's all of those things. There really is no consensus on how many people are performing treatments that they have no business doing.
Right.
And it could be a member of the public who's decided they want to take something on, injecting unlicensed substances in a hotel room, for example. There have been cases of that. Down to people performing filler injections, Botox injections who have no training or perhaps maybe took a weekend course and lack a lot of the experience that's necessary to do it properly. Personally, I'm biased, of course. I'd like to think that people performing any sort of a medical intervention should have a great deal of training and experience in order to do it. But, well, with so much on the internet these days, it's hard for the public to know who's legitimate and who isn't because anybody can look qualified just with the right web page.
And do those people tend to have much lower prices? Is that why people go to get it done in a hotel room?
Often that's the case, yes. It's a question of looking for bargains. And, the old adage remains true that if something seems too good to be true, it probably is.
I think there are some things you don't want to get on sale. Like a mattress is one because you're sleeping on it every night, and a facelift might be another.
Yes, I totally agree. There's some things where, let's face it, a commodity is a commodity, but your healthcare, particularly surgical treatment, It's not a commodity. So I strongly believe that looking for bargains, well, you're going to get what you pay for to a great degree.
All right, we're going to talk about some of the procedures that you do. And we do have one caller already. And if you do want to ask Dr. Bray a question, it's 416-872-1010, star talk, star 8255. You can text us at 71010. We will start with Alberto. Hi, Alberto. Go ahead. You're on with Dr. Bray.
Yes, hi, good evening.
Hi.
Just a few things. I didn't mention it to the caller before regarding hair transplants. You don't do that.
I personally don't do it,
Okay.
but
No, okay. But my first question was, I've heard ear pullback. You know, they pull back the ear.
They pin the ear. Is that what they call it?
Pin the
Pinning
ear,
ears
yes.
back?
oh, you mean for someone whose ears are sticking out too much?
Like, my ears are not sticking out, but I have this thing that I prefer it pinned. Not pinned, but, nudged on the top backward. Back
Well,
towards the head, I guess.
sure, yeah. The position of the ears, the shape, and the amount they stick out, that can all be changed. The fancy medical name for that is an otoplasty, but
Yeah.
you could call it an ear tuck or ear pinning for sure.
Is that
And
something you
what's the
do?
price range for that?
It is something that I do, and the cost, it can vary for sure, but expect it anywhere from $2,500 to $3,000, perhaps up to $5,000.
Is that for
Um,
both years or 1 year?
that would be for both, but it's
Okay.
the sort of thing that would require a proper assessment,
Yes, I understand.
and then someone can fill out all the details.
Yeah.
There
Can
are
I
some
ask also
factors.
something?
Yep.
My wife is embarrassed to ask.
Uh-huh.
Regarding, the inner legs,
Yes.
to, I don't know if you do it, you cut it or you liposuction it.
It could
The
be
inner, the
Because you
inner
can do
leg.
both a
thighs.
thigh lift or just a liposuction, right?
That's true. And depending on a few factors, how much fat there is, the quality of the skin, the surgeon would tell you what option would be most appropriate. The treatment I've been doing most often for that is a new type of liposuction called Body Tight that allows me to remove fat, but also gives better skin tightening than more
Is
traditional.
that painful?
No, afterwards the area is sore, but people are up on their feet, they're active, just need to take it easy from heavy activity for several weeks
Mhm.
and wearing a compression garment, almost like a pair of bicycle pants to keep the swelling down for about
And the recovery time regarding the ears and also the liposuction, what is that?
um, several weeks for both of those things. With the ears, there's really no restriction on major activities. With the legs, heavy exercise, running, jogging, that sort of thing, need a break from that for about a month.
Okay,
Thank you. Thanks for the call, Alberto. And we're going to take a break for traffic. Questions are coming in. I have a million questions of my own. These are very interesting topics. Also want to talk about the cost for people to come and see you, whether you do financing, or we're going to talk about all of that.
Sure.
We are with Dr. Peter Bray. He's a cosmetic plastic surgeon. We're talking about the most popular procedures in surgery for both men and women. You are welcome to call with your questions, 416-872-1010, star talk, star 8255. Text us at 71010.
I can't believe you sent a woman into the sauna to do that.
That
to
was
me.
an accident!
I think you're both mentally ill.
Oh.
And by the way, they're real and they're spectacular.
Welcome back to the Night Side. Barb DiGiulio, I'm with Dr. Peter Bray. He's a cosmetic plastic surgeon. That was the famous Seinfeld, they're real and they're spectacular. And when I mentioned to Ryan Doyle earlier today that I was going to be joined by you, his guess was for women that breast implants would be the most popular surgery. Is that the case?
It still is. It's one of the top three and has consistently been for quite a number of years now. But it's changing, and fortunately, there's more of a trend towards smaller, more tasteful, and proportioned sizes. So I think that's a great development. I'd like to see that gone are the days of the great big unnatural looking melons on the chest. I don't think that's a good look for anybody.
But you'll do it?
No, I will not.
You will not do the big, huge, fake-looking ones?
No, no. People come to see me for natural looking results. That's typically what they want. And by word of mouth and through other things, fortunately, that's why people come to see me. There are, certainly ways of getting melons on the chest, but I don't want to go down that road.
You want to keep it more natural look.
Yeah.
How
yeah.
long do they last?
There's really no set lifespan. Although you'll read from the internet and other things that they should be replaced every 10 years, but that's not exactly true. In that 5 years, 10 years down the road, if everything is good and you're comfortable and you're happy, there's really nothing to do. But I always recommend for my clients that they come back at least once a year just for a check and to see that things are good. And there's a long educational process related to things like mammograms and breastfeeding and all of the other important things that have to be discussed beforehand.
We have a lot of people calling in to talk to you. We have a text request here. I'm a 58-year-old woman just starting to get some saggy skin around jawline and under jaw. Can laser treatments work for that?
Maybe. It really comes down to how much sagging and how much loose skin there is. Laser or light-based treatments or certain other non-surgical energy treatments like thermage can help with that. Whether it's powerful enough to give you the result you want, that would require assessment with your surgeon or practitioner. It may be that you need something a little more powerful. There are minimally invasive treatments, tiny incisions where the energy is delivered underneath the skin to give better tightening, and the one I like to use is called Face Tight. It's got a great name. Whether that alone is enough or getting into something like a facelift, that really requires a proper assessment by someone who can give you all the details about those options.
How does that work? If somebody comes to you, do they pay a consultation fee?
They do. My consultation fee is $150, and that varies quite a bit. Some surgeons will be more, some less. Some will provide free consultations. So a bit of investigating and calling around may be worth your time. That said, what you'll probably find is for free consultations, again, you're going to get what you pay for. More than likely, that's going to be a very quick visit or a screening appointment, whereas consultation you pay for, you've got the surgeon's time and usually invested in answering all your questions, making sure all the bases are covered, and that you're fully informed.
How long does the consultation normally last?
30 minutes to 60 minutes with me, depending on the situation. But if people need more than that, I'm happy to stretch that longer or make subsequent appointments. I have really no limit or number of appointments required prior. If somebody wants more time in order to ensure they've got all the bases covered, no problem.
And if they decide to go with you, does that consultation fee get put toward their surgery? I know some people, is that how that
absolutely.
works? Okay,
Yeah.
so they don't lose any money if they decide to go with you, then they're not paying the $150 on top
That's correct.
of the cost of the
Yes.
procedure. Okay, let's go back to the phones. We've got Mike on the line. Hey, Mike, go ahead. You're on the night side with Dr. Bray.
Hi, doctor. I'm 50 years plus male, and due to different reasons, I tried to diet and everything. I've lost about 200 pounds plus.
Wow,
So
congratulations.
there is a frill of skin around me, which is hanging, which not just unsightly, but there's rashes are developing underneath it, and the same thing is on my thighs. There's a lot of loose skin on. Is that covered by OHIP, or do I have to pay for this?
That's a good question.
Congratulations again, by the way. That's tremendous achievement. And you're not at all alone with many people losing that amount of weight. Discover that there's loose skin in all sorts of areas: abdomen, thighs, back, buttocks, arms. So treatment to remove the loose skin and tighten everything up is something that plastic surgeons do. And for the most part, it will not be covered by OHIP.
Okay.
Sometimes in select circumstances for the abdomen area, it may be covered, but the government's guidelines are very strict, and there's quite a degree of severity that must be there before it would qualify.
And what would be the cost if I go on my own?
Let's talk about the abdomen part. It may just require a tummy tuck, so removing the loose skin in the front, but with that amount of weight loss, often what's required is what's called a body lift, where it's not just the front but the back as well, so all the way around. And that could get up into the high teens, $20,000.
Can you do that all at once? Because that's a lot of skin to remove and a lot of stuff going on.
Yes, I prefer to do that all at once because the balance, proportions, and the result, I think, is better. And often my partner and I work together doing these cases. We're two experienced surgeons and working simultaneously with exactly the same plan. We can work quite a bit faster. So when he schedules one of these procedures, I work with him, and then vice versa.
Okay.
Yep.
Mike, thanks a lot for your call, and hopefully that helped. And we've got to take a break. We are going to continue talking about things like the most popular procedures for men and women, and the hottest trend for men in cosmetic surgery in 2015. Dr. Peter Bray is here. He's here to answer your calls, 416-872-1010, Star Talk, star 8255. Text us at 71010. He is a cosmetic plastic surgeon. The name of your company is?
It's the Elements building on Avenue Road and a couple of other offices. I also work with the Bel Air Laser Clinic in Yorkville and cover both surgical and non-surgical things that way.
All right, more of your calls with Dr. Peter Bray, cosmetic surgeon. When we return, it is 8:24 on In-Depth Radio, News Talk 1010.
I did have prominent veins and tendons sticking up, and now you don't see them at all.
You're messing with nature.
Nature messed with me. I don't have any problem messing with nature. That's absolutely true. I'm messing with nature. But that's what people do. We redirect water. We call it plumbing. That's not natural.
Welcome back to the Night Side. Barb DiGiulio. Dr. Peter Bray is my guest. He's a cosmetic plastic surgeon. That was a woman who has had 52 plastic surgeries done or cosmetic surgeries done, and explaining why. Is it true? Did nature mess with us? Is that why we should be doing these things?
Well, nature changes people. There's no question about it. And humans are visual creatures. They've been modifying their appearance ever since any sort of recorded history. So messing with nature is nothing new. I think it all depends on the way in which it's done and if it can be done with meaningful changes that are tasteful and attractive and balanced and sensible. I don't think there's anything wrong with that. But the extremists getting into dozens of plastic surgeries, I think we've passed a sensible boundary there.
416-872-1010. If you have questions for Dr. Bray, Star Talk, star 8255. Text us at 71010. Any questions regarding cosmetic and plastic surgery, he is here to answer them. Back to the phones we go. Elvina, you're on with Dr. Bray. Welcome to the show.
Thank you for taking my call. I have a question. I've been to several doctors, including a plastic surgeon, where I have, after having 3 kids and supposedly being born with my stomach muscles somewhat apart, after those pregnancies, I've got the stomach muscles that have completely separated, and the fascia layer underneath has separated as well.
Yeah.
So literally my bowels spill out in front of me. I look pregnant all the time and have an excessive amount of skin. What I've been told is until I have a strangulated hernia, not the retractable hernia I can't get that fixed. And in addition, I was told if I were a patient who had been overweight, obese, and lost 80 pounds, I would qualify to have OHIP remove that skin. However, having even gained, 80 plus pounds first pregnancy, over 50 second, and almost 100 with the third, and having lost every single pound every time, I don't qualify for that because I was pregnant instead of just obese. But I'm having health issues related to this whole digestive and bowel and whatever issue. Why doesn't OHIP help women who've had children?
A couple of things there, and I certainly can't speak on behalf of the government, and I would never speculate on a lot of their mandates. So the government's rules, I can give you my interpretation of them. And generally speaking, they're not interested in correction of a problem unless it's some significant risk to your health. So the way I would see it in this case, the loose skin and the way your fascia isn't putting your health in danger at this point. Again, this is my interpretation of the situation. And the same thing for somebody who's lost a significant amount of weight through bariatric surgery or gastric bypass surgery. No, they do not automatically qualify. OHIP doesn't care what you look like. And if there's a lot of loose skin, it doesn't matter how you acquired it, whether it's pregnancy or weight loss. The fundamental thing they would look for is your health in danger because of it? If not, they will not cover it.
Alvina, have you looked into doing this just on your own and having to pay for it? Have you found out how much it would cost?
I did, and I found out that they said because I would need 18 laces from top all the way down to the pubic bone, that it would cost around $10,000, and that because they can't be quite sure if I've got any bowel loops that would kind of need to be, I guess, put back in place, that it's going to be a high cost that usually it's about 8, but in my case it would be 10. That would also include removal of excess skin. And that's unfortunately something where I can't do it. And with my family doctor and even a gastroenterologist that I see on a regular basis because of the health issues that this problem has caused, I was told that until I have some kind of medical emergency like a strangulated hernia or some kind of damage to that part of my body, that there's nothing that they can do to help cover even any of the cost of it. So, and it's a huge amount of money. And like I said, I've got 3 children to save for their schooling, and they play hockey. And,
no, you don't have to
regular
tell
life.
us. We're all parents, right? And the doctor has 2 kids as well. I mean, everybody knows how expensive it is, but it sounds like this is something that's bothering you, but also physically, it sounds like.
Yes, and mentally as well. When you've worked hard to lose the weight and you eat right, and I've been also diagnosed with gastroparesis, which adds to the sometimes ruining a day of digestive problems. And I've been told that this would help and put things back where they were, because sometimes I have pain that they said comes from, I can't remember if it's my liver or it's one of the smaller things beside the liver that's not being supported because of the bowels and the way they kind of pour out.
Okay. So is this something
I have pain and I can't lean against a counter or pick up one of my nieces with her on my hip, because if her leg touches the front of my stomach, it hurts a lot. I can't wear any kind of tight pant or jean because of the pressing on the stomach becomes very painful, and still there's nothing they can do. It's also impacting my mental health because
Right.
this is a constant problem.
Sure. Alvina, thanks a lot for the call. And Dr. Bray, is there anything you would recommend for her? I mean, it sounds like it's very, very frustrating.
Sounds as though the family doctor or gastroenterologist have been involved. So getting those assessments is, of course, important to do, and supporting the abdomen, the abdominal muscles with the use of a binder. You've probably tried that already. And unfortunately, OHIP's rules, as I understand them, is they are black and white. Things where there are shades of gray often fall through.
I thought
are
it was
hard to
great
done.
what you said. OHIP doesn't care how you look.
That's true.
That's actually an excellent thing for people to remember. Let's go back to the phones. We've got John on the line. John, thanks for holding. Go ahead with your comment or question for Dr. Bray.
Hi, Dr. Peter.
Hello.
I've got to ask the obvious question that all men want to know.
All right.
I was told by the screener to call a male member.
Uh-huh.
How much could you make it longer or bigger, and how much would it cost?
Well, not something that I do. And as far as I understand, no one in Toronto currently doing that particular procedure. At one time, there was a plastic surgeon who specialized in that, who's since retired. And as to the effectiveness of that procedure, it's a debatable thing. But as I said, not a procedure that I undertake myself. There was someone in BC who was doing that, and maybe in Montreal, but my information may be out of date.
John, is this something you're asking out of curiosity, or is this something you would actually consider having done?
Oh, no, definitely curiosity. I just thought all the men would want to see their hair.
Yeah, and that's funny. No,
we
no.
talked about boobs and bums for the ladies, so I thought we'd
For
want to
sure.
talk about the men's.
And it's a great question, although I did hear recently somebody told me that they had heard not a lot of success out of this procedure.
True. And it's an illusion, really, by repositioning the skin at the base of the penis, giving the illusion that more of it is visible. It's not really changing the overall length per se.
It's kind of risky business and when you're dealing with that area if you're not going to get a lot of success.
True. You don't want to mess around because, let's face it,
You only got one?
exactly. That's the good way to put it.
Okay. That's how I would look at it. All right. Question for the doctor. Is it better to do a breast reduction after having children or before?
It depends how much they're bothering you. Yeah, whether it's worth investing in that reduction prior to having the babies. So I do a lot of both. There are some young women who are so heavy and so uncomfortable that they want a change made now. And babies aren't on the horizon for a number of years. And then women afterwards who've had maybe a change in size or the effects of gravity and are now ready to go ahead with that. So not necessarily any right or a wrong answer, but
Does it affect breastfeeding?
it might, yes. So that's an important part of the discussion prior. For that person who's absolutely committed to breastfeeding and it's something they must do as a woman, as a mother, then it may be best to wait until after. So this is all the type of discussion you need to have with your plastic surgeon.
Dr. Peter Bray is a cosmetic plastic surgeon. He is in with us until 9 o'clock, 416-872-1010. If you have any questions, Star Talk, star 8255. You can text us at 71010. Welcome back to the Night Side. Barb DiGiulio, and my guest is Dr. Peter Bray. He's a cosmetic plastic surgeon in Toronto. And we're talking about all kinds of procedures for men and women. We're taking your calls and questions if you have any. 416-872-1010. Star Talk, star 8255. Text us at 71010. Have you heard much about, because I've just started hearing about this thing where women, and I'm sure men, I'm only hearing about it with women though, are going to places like Mexico and Costa Rica to get procedures done that are apparently very good and at a very inexpensive price compared to what they would pay here.
The whole surgical tourism phenomenon, people traveling to other places, other countries to get things done. And cost is a big part of that factor. They're looking to get things done at lower prices. The quality is another matter. It can be very good and it can be disastrous.
Really?
Oh, yeah.
Have you seen anyone that's needed something fixed?
Yes. So just last night, I was on call for the hospital and someone came in having had their surgery done in another country and had terrible complications. So she had to be rushed to the operating room.
What kind of surgery was it? Can you
It was
say?
breast implants and had developed bleeding afterwards. Now, there's lots of people who will go to great places, get a very competent procedure, but there's a lot of due diligence that people have to do. If price is the deciding factor, then yeah, it's buyer beware. And the other thing too is let's assume you have a great procedure done, but then you're now back in Canada and through bad luck have a complication. Who's going to take care of you? So sometimes that can mean a trip to the emergency room in the middle of the night. Nobody knows what's done. There are no records. You know, I've been in that situation where I'm flying blind and trying to figure out what do I need to do to solve this problem. It really requires some careful thought. The other thing too, if you were to run into trouble when you're down in this other country, most of the time your insurance will not cover you if there was a complication that arose while you're down there.
From cosmetic surgery, if that's
yeah.
the reason. Oh, isn't that interesting? I think to your earlier point, just the thought of having a procedure done and then coming home and then maybe something going wrong. I mean, it's not something where I would think you would want to be far away from the surgeon who looked after you.
True. It's important to have a follow-up plan or a backup plan in place if something goes wrong. Sure, you may get lucky, you may not. So important to go into that situation eyes wide open and definitely having had your research done.
So we've got a couple text questions for you. One is from Peterborough. I'm a large woman, 6'2", with a big frame, but not fat for my size, even though I weigh 220 pounds. However, my breast cup size is only B. I have been told that double D cups would not look large on me. Is that something you would perform if you saw her and you believed that it would work in terms of her frame?
It's all about proportion and spend a lot of time taking measurements and planning to give a result that fits and looks natural. That said, I don't think too much in terms of cup sizes because they're very misleading. I'm sure every woman has tried on bras from La Senza, Victoria's Secret, Triumph, and found their different cup sizes and all those things. So the usual thing I say is, well, I can make the breasts, but I don't make the bras. And I'd be happy to provide a result that was tasteful, balanced, and well proportioned. And then whatever the cup size ends up being after that, that's what it is.
Right. I shouldn't be surprised that you know your bras, but I think that's very cool. Is it possible for a man to have a breast reduction, and how much will that cost? So that's what do they call it? Gynecomastia?
Gynecomastia, or the dreaded man boobs,
yeah.
or moobs, whatever you want to call them. And yeah, it's one of the fastest growing procedures for men over the last few years, and I do a lot of it. One of the most popular things that I do. So overall, my practice now is probably 40%, maybe even 50% men.
Wow.
And yeah, male breast reductions is a big part of that. I have a special technique that I think is great, using a special liposuction and minimally invasive interventions, so small incisions out near the armpit. And the cost, it'll vary a little bit, but expect it to be around $7,000, give or take a little.
That, not to be critical, that sounds a little high, but is that, because I don't know. I don't know what I'm comparing it to. I guess it's a little bit more intrusive than I thought it would be.
Yeah, cost is a difficult thing to compare, either between techniques, between surgeons, between locations. But what I'm doing is using advanced, newer technology, and it's therefore more expensive than the older fashioned or more traditional ways. So this is a big part of the discussion and an educational component. You can certainly find male breast reductions for maybe $4,000 or even $5,000, but that would typically be making cuts on the front of the chest using conventional liposuction, and that's okay if the client is happy with that. So again, it really
Is yours sort of virtually invisible?
It is, yeah. With a small incision in the underarm area, it's really hard to see unless someone goes staring into your armpit.
You know, I find interesting that men and women, a lot of them, especially celebrities, tend to go for facial work as they get older. And some men, unfortunately, end up looking very feminine after they've had stuff done. Why is that?
It's a combination of the techniques used. I think part of the problem is the techniques that are used in women, like augmenting the cheeks and lifting in a certain way, is applied to men without realizing that they've got a different overall structure. Men's faces are built differently from women's faces. And if you apply the same techniques to both, you're going to get a similar result, or kind of a homogenization. So I totally agree. When cosmetic procedures are done without respect for the structure of men's builds, it can have a feminizing effect, and that's not a good thing.
George Clooney's jawline is the hottest trend for men in 2015. Is that true?
It's popular, and whether it's George Clooney's or Brad Pitt's or whoever's. The whole idea of having a stronger, better defined, and more youthful looking jawline is popular. I think a lot of that's being driven by the selfie culture and Skype and webcams. People are now seeing themselves all day, every day, and realizing, oh my God, is that really what I look like? That's spawned a lot of people to get things done to improve what they see.
You mentioned that the male breast reduction is one of the most popular procedures that you're performing right now. What would it be for women?
Breast implants are popular, and tummy tucks are what you'd call the mommy makeover. Tummy tucks with something like a breast lift, and liposuction for those troublesome areas like love handles, outer thighs, and the dreaded saddlebags. All very popular.
Someone is asking, what about heavy eyelids? Is there a fix that does not involve surgery?
Generally, no. For eyelids, really, surgical treatment, what's called the blepharoplasty, is by far the most powerful and effective way. It isn't an area that's really benefited greatly from non-surgical techniques, whether it's laser or other light therapies. Those can help a teeny bit, but surgery is still going to be the mainstay for sure.
And how expensive is that type of surgery?
For upper lids, usually just under local anesthetic, probably about $3,000.
And lower lids about the same?
A little more because it's a bit more complicated, time consuming, and delicate. So it'd be a little more than that, yeah.
Okay. We are out of time. I thank you so much for this, and I hope that you'll come back again.
Terrific. Love to be back.
Dr. Peter Bray, cosmetic plastic surgeon. Is there a website people can check out for more information?
Dr. Bray, that's DRBRAY, plasticsurgery.com.
All right. This has been very interesting, informative, and we thank you for staying up late because I know you have early mornings.
Terrific. I'm glad to be here. Thanks.
Thanks a lot, Dr. Peter Bray. You're listening to In Depth Radio, News Talk 1010.